morning, everyone. Myself, Aishwarya Mahanti, is going to present on OCT, a new hope for lazy eye. Amblyopia is loss of vision with no organic defect. With a prevalence of 1 to 5%, it has become the leading cause of unilateral vision loss in children and young adults. About 50% of amblyopic children could not achieve complete vision of 20/20 despite appropriate treatment, which is attributed to structural and macular abnormalities. With the advancement of OCT, it has given a new horizon in understanding this etiology. My aim is to measure and compare the central macular thickness of amblyopic eyes with that of normal fellow eyes using SD-OCT in the age group of 3 to 15 years. It was one observational case control study within a span of 1 year. My sample size was 46 pairs of eyes, out of which amblyopic eyes were cases and the normal fellow eyes were control. It included children between 3 to 15 years having an intraocular difference of 2 or more lines, with BCVA in amblyopic eyes 6 by 12 to 6 by 60 and that of fellow eyes 6 by 9 or better. Any previous history of ocular surgery, deprivation and bilateral amblyopia were excluded. A written informed consent was taken and a comprehensive ophthalmic examination including visual acuity, refraction, slit lamp and fundus examination and OCT examination. This is one of my patients undergoing OCT evaluation. Now coming to results and discussion, 63% of my cases belong to the age group 7 to 10 years. There was no significant difference between male and female in the occurrence of amblyopia. Regarding the types of amblyopia, 70% were anisometropic, 25% were strabismic and rest 5% were mixed. This table shows this comparison of CMT value between both the eyes. In anisometropic amblyopia, the amblyopic eye had 236 micron while that of non-amblyopic eye had 201 micron, and in strabismic amblyopia the results were insignificant. Firstly, my study found 26 anisometropic amblyops who had thicker CMT value in comparison to sound eye. To support this, Juan et al. Have proposed that arresting of apoptosis of retinal ganglion cells would lead to increase in macular thickness. Secondly, in strabismic amblyopia, there was no change in CMT value. Thirdly, 6 of my cases had thinner CMT value. Park presumed that it may be due to significant thinning of ganglion cell layer plus inner plexiform layer at macula. Emphasizing the pathogenesis, it is established that the pathology of amblyopia lies at lateral geniculate nucleus and primary visual cortex, but some recent studies have revealed it is associated with underdevelopment of retinal ganglion cells. Henceforth, the role of retina is still controversial. But with the recent use of OCT, it has made possible to quickly and non-invasively measure the retinal structure with its improved spatial resolution and scanning speed. There were certain limitations to my study. Firstly, the study had small subject number and the effect of amblyopic treatment could not be evaluated as the treatment history varied from no treatment to non-compliance with the treatment. To conclude, my study found anisometropic amblyops had thicker CMT value in comparison to sound eye, while that of the strabismic amblyops had no change in CMT values. In the end, the question again arises, can OCT be a new hope for lazy eye? In my opinion, yes, as it broadens the knowledge of macular structure associated with amblyopia and it helps in better defining it. It can be a future diagnostic tool and help the clinicians in predicting the treatment outcomes. We can also evaluate the effect of amblyopic treatment on the macular thickness. Therefore, OCT is highly recommended in moderate to severe amblyopia if subtle macular abnormalities are suspected. Thank you.
3-year-olds cooperated for the OCT?
Yeah, oh sir, that was some limitations. Some people they didn't, but OCT I took the parents with them, and with the help of the parents I did the study. But my below 5 years they were very less of my population.
Okay.
Which OCT you used?
SD OCT, ma'am.
Dr. Aishwarya, the significance in the CMT difference, was it statistically significant or was it just
No, it was statistically significant in anisometropic and
Yeah.
mixed. But in mixed, I had very few cases, so I couldn't comment on that. And in strabismic amblyopia,
That was not.
it was insignificant.
Right.